Hi everybody, it's Dr. Magnifico from JRSFullVet and Poppy.com. This is Bonnie. She's a young Doberman. She was playing with another dog and who was on a Flexi lead, and this is what the Flexi lead did. I make no bones about the fact that I just do not like Flexi leads. This is what I see. I see these, quick lacerations when the Flexi lead gets too tight or kind of wraps around them. It really sort of acts like a guillotine wire. So I just don't like Flexi leads. You're just much safer on a normal leash, 6 feet long, because then they can't run and they can't catch the leash. So she has a laceration to her skin. It's really right behind her left shoulder. The good news for her is that it's really just the superficial layer of the skin. So whenever I'm assessing a laceration, I need to know how deep it is and then if there's a pocket underneath it. The big thing that we're concerned about is if you get a ripping or kind of tearing wound, you can pull the skin away from the muscle and then you get a big pocket underneath that skin, and that pocket is a perfect place for bacteria to kind of take residence, and then we worry about infection. So if it's a full skin thickness, or even if it goes down to the muscle and if there's a big pocket behind it, we're going to recommend a surgical cleaning so we can flush the whole thing completely, and then sometimes we put drains in if we're worried about trapping that bacteria in, or if it's a really dirty wound. Because this is just really through the skin, so as you move the skin, the tissue underneath it is kind of moving with it, so there's not a pocket and it doesn't go through, it goes through the skin, but it's not affecting kind of the fascia underneath. So we're gonna clean it. We of course shaved it first. She is just muzzled. She's being a very, very good dog. She's actually a very, very good dog anyway, and she's not incredibly painful. So these are one of the few cases where you can clean it and then just provide kind of topical care. So we shaved up the area, we cleaned it with, this is a surgical scrub, so we kind of drown it with the surgical scrub, and then we use a curved tip syringe, which actually gives some force so it will kind of flush out the bacteria. So we've been cleaning it really well and getting all the hair and all the dirt out, and then I'm just going to place some staples on it to hold it closed. I'm going to send her home with an antibiotic. Sometimes I send them home with a non-steroidal anti-inflammatory for pain if I think that they're painful, and then she'll come back in about a week or two for the staples to be removed. And as long as we can keep this clean and dry and minimize the tension and the force and the movement on that skin, she should be just fine with that. So this is a case where we don't need surgery, and as long as they can keep it clean and dry and protected, I think staples will be enough to hold that skin edges of hose and allow this the time that it needs to heal. If you have any questions about this, you can find me at JRSFullVet for an appointment, or you can find me at Poppy.com for a free question. Take care, and thanks to Bonnie and her family for letting us do this. Take care, bye.